Well, at this point in time, we know we have to discuss the elephant in the room. And I know what you're all thinking right now. Is this guy the best they can do for the gala? Well, you can't get better, but you can't pay any less. I really do want to take a few minutes and talk about the other elephant in the room, and that's COVID. Our world will never be the same. A global pandemic rocked our nation and turned all of our lives upside down. We have all been affected by the calamity in some fashion or another. And while some have lost loved ones, while others have had their livelihoods threatened, others of us have had to endure hardships that we'll never fully recover from. Now, while this was a global pandemic and everyone in the country had to endure this scourge, it is worth mentioning what was done for us on a local level. The doctors, providers, nurses, and staff at Trinity Health have been nothing short of heroic. They selflessly put themselves in harm's way. Yes, they put themselves in harm's way to care for our families and our friends and our neighbors in the face of adversity, knowing that the risks to themselves were real. They worked with unwavering commitment and they performed brilliantly in some very difficult conditions. In fact, the entire healthcare system worked tirelessly to support that effort. And now when the nation became divided on healthcare policy, the team at Trinity Health rolled up their sleeves and they went to work to do whatever it took to provide the best care possible for all of us. I've often used the phrase since the start of the pandemic, and it applies till today. It's been COVID hell. Truly the hell on earth. I want to take a moment to say a special thank you to everyone who cared for our COVID patients or supports the effort to provide that care. If you have taken care of a COVID patient, or if you've been on the front line, whether you're a nurse, a doctor, a provider, or staff, I want you to please stand so that we can recognize you and feel our appreciation for everything that you've done. Because you truly, truly are very special people. Thank you. You know, there was a real fear when COVID first started, and there is still great respect for what this virus can do. We can't get complacent about it. You know, when it first started, there were no vaccines, there were no therapies, and the people who were getting really sick and had long hospital stays. If you were in the ICU, your chances of survival were very small. The COVID patients went through, just like I said, hell. It was awful. The whole staff of Trinity were resolute. We mourned the passing of the patients and we celebrated the survivors. So COVID has affected us in so many ways, and as an ICU doctor, I was in the midst of all of it. There were administrative and logistical issues to consider, and the patients were incredibly sick, and we had limited tools to help them. There were also reports in the nation that healthcare providers were dying because of their exposure to COVID. Now, all of this reminds me of a letter that a Civil War soldier wrote. His name was Sullivan Ballou. And if I can have your attention, and please listen to this. I think this message will resonate with all of you, so if I can get your attention, please. Sullivan Ballou was a Civil War soldier, and he was worried that he was going to die. And he wrote a letter to his wife on the eve of a battle. This letter was memorialized by Ken Burns in the documentary The Civil War. The letter was read to the haunting but beautiful music called Ashokan Farewell. What I'm about to read for you tonight is my attempt to bring similar sentiments, except now that COVID has been the enemy. Following my reading of this letter, we'll have a toast from our President and CEO, Mr. John Kutch. What you're about to hear next is an original, and it's called A COVID Farewell. My love, as I write this, I'm prepared to cover call in the ICU for the coming week. The indications are that COVID is raging and is ravaging our patients. I feel compelled to write to you and share my thoughts, especially if something should happen to me. The work in the ICU is heartbreaking. The toll that COVID is taking on the patients, families, and staff is heavy indeed. All eyes turn to me for answers. They look at me with desperate pleading. They look for hope and reassurance. As this virus spreads, the number of cases in the hospital rises and rises. The fear that the patients and families feel is palpable. For some, as their situation worsens, the cold reality of the situation sinks in. Their faces reflect all of their emotions at once. As the virus takes hold, many succumb to pneumonia, and they literally have their breath sucked from their bodies. The hell these patients must endure is unimaginable. I see firsthand how this virus rips lives apart. The families are kept away from their loved ones at a time when they need each other the most. The words of encouragement that we offer, they ring hollow in the ears of desperate wives, husbands, children, and family. At times it seems that all we can offer are prayers, but that's precisely what they need. The loss of life, as well as bearing witness to the struggle these patients go through, has battered my psyche, and it's tested my resolve. But despite the headwinds the virus has put in my way, I find strength through faith in God to push on and look for ways to help our patients so that I may fulfill my oath to care for people during the most vulnerable time of their lives. The people we care for look to us to help them. The care team selflessly puts themselves in harm's way knowing that the virus has proven itself to be a killer. The staff works in such difficult circumstances. It's impossible to say what is the hardest part. The patients are incredibly sick. Protective equipment is limited. The patients are isolated from the staff and also from their families. And we have limited treatment options, and there's real fear the virus could spread to us. As I watch them work, the staff exudes a quiet professionalism. They go about their work and they are doggedly resolute in their desire to give the patients the best care that they can. I am so very proud of all of them for the work they do and the care that they provide. As all of this unfolds before my very eyes, I'm filled with so many emotions. While most of the time I try to focus on the tasks at hand, I cannot help but have some fear myself. I am scared the virus will infect me too. I am scared that I might be counted among the victims of this pandemic. I can only pray that if I do indeed find myself at the mercy of this virus, that I will show myself to be as brave and courageous as the many people who perished before me. My love, my duty is clear, despite the risks. I must be there for the patients and the staff. The health and welfare of the patients who live in our part of the world depends upon us to be there. It is our duty. It is our obligation. So despite the potential for calamity, I'm willing to put it all on the line. The risk from this virus is real. And despite those risks, I have faith that I will return home to you. As I struggle through my days battling an invisible foe, I cannot help but let my mind drift to better times with you. I thank God for putting you into my life. I pray that you and I will grow old together as we experience the sunset of the day and the sunset of our lives. If by some cruel twist of fate I get sick and I find myself struggling to breathe, and as I feel the last ebb of my life slipping away, I will whisper your name. My love for you will never end. While death may end our earthly lives, our love will live on for eternity. I know that after we pass, we can still be near those who we love. And when my time comes, I want you to know that I will always be close by. Not even God Almighty will be able to keep me from coming around after you. When I have gone, and you are wondering if I am near, just listen to the rustling of the leaves on a summer night. It will be me saying hello. When you feel the cool breeze against your cheek, it will be me kissing you. I will keep coming by to say hello and remind you that I will be waiting for you, patiently waiting for the time that you and I will be together again.
Grateful and supreme thank you to Dr. Burhan, Dusty Zimmerman, Cody, Jamie. What a splendid and wonderful evening tonight you have prepared for all of us. Round of applause. I also want to thank our sponsors again. They have been mentioned throughout the evening tonight. There is one group of individuals I want to express a very sincere thank you to as well. It's the sleep-in staff tonight. Thank you for being here tonight to help us see to it that this event can take place. We all know how hard it is to find help in whatever industry we work in. I just want to thank the sleep-in staff for being here tonight. I do have some very brief remarks that I wanted to share with all of you tonight in the form of a toast. And this is going to be a very special toast tonight for all of us. This is a toast to new times and a new life. A time when the COVID pandemic is behind us. A time when we are moving into and have moved into onto a new campus. So let's raise our glasses and listen to these remarks. From the very beginning, Trinity Health Foundation has supported the Trinity Health mission by raising money, programs, services, and technology needed to care for patients, help us care for the patient population that we serve in Northwest North Dakota and Eastern Montana. Trinity Health is in the midst of a major construction project that will result in a medical destination for Northwest North Dakota and Eastern Montana. The 6-story healthcare campus and medical district will indeed identify Trinity Health as the medical destination in Northwest North Dakota. With private rooms, state-of-the-art surgical and imaging equipment, and a focus on enhancing patient-centered care and the family experience, the healthcare campus and medical district is designed to create continuous platforms of care that support clinical excellence. With a capital campaign goal of $15 million, the Trinity Health Foundation is approaching that midpoint of its goal. The foundation needs and looks forward to your philanthropic giving over the next few years to transform healthcare at Trinity Health by providing support for the latest advancements in trauma, surgical, and cardiac care, as well as technology and all other advanced healthcare programs. Thank you all for being here tonight. Thank you for the gift of your friendship to the Trinity Health Foundation and Trinity Health. Enjoy the evening.